Miss Jones. How we doing today? Yeah, I heard. My name's Grace. I'm going to be your respiratory therapist today. I believe that the doctor ordered some suctioning. I'm just going to do a few things before we get started. I'm going to go wash my hands, gather my equipment. Before I do anything, I'm going to go ahead and make sure that Mrs. Jones has her vitals checked and that we are doing this for the right reasons. Miss Jones is aspirated. She was getting chemotherapy treatment, so there's a need for suctioning to prevent infection. All right, I'm just going to give you a listen really quick. Sounding a little coarse, but that's okay. Our oxygen is 91%. Not bad. She is panicking a little bit, so I'm just gonna let her know everything's gonna be okay. Right, I've got all my equipment. Now I'm gonna create a sterile field. Get this open here. Before I put on my sterile gloves, I'm going to go ahead and turn my suction on because this is an adult. We're going to do between 120 and 150. Got my suction right here. Everything's working right.
Yo, what is class?
Only touching the inside of the glove. Now, because I'm using the other one, I can touch the outside of the glove because this one is sterile on the outside. Okay. Now I'm gonna go ahead and set this up. I have water in here, sterile water, in case this gets clogged or has any secretions in it. Now, before I start, kind of want to give it a little wrappy wrap here. Actually, go ahead and slide this back. Okay. Normally I would lube this up. Kind of give it a little twisty motion. Once I feel resistance, I'm going to go ahead and I'm going to occlude this and twist it as I pull out, less than 15 seconds. Okay, now that that is done, I'm going to go ahead and take off my gloves, my sterile gloves. Throw away any of the materials I used. How are we feeling? Miss Smith says she's feeling a little bit of relief. I'm gonna go ahead and check the breathing, check the vitals, make sure that there weren't any major changes. Patient sounding a little less coarse, so that's good. I'm gonna go and wash my hands, talk to the physician, and make sure that I chart all important information. And check in a little bit, make sure everything's still good with this patient, see if we need to do it again. Again, suctioning is only PRN if there is evidence that shows that it's needed.